o'clock. So feel free to jump in, turn on your audio and video and ask a question, stop us along the way. Feel free to add a question to chat. We've got a lot of questions that were already submitted, so we're going to jump in with those first. And then we've also protected time at the end to be able to get even more of your questions. So, So here's just a quick kind of look at what you've already asked us and that we're going to try to answer today. As you can see, it's a lot of, why were we started, kind of what's our background, to like the nitty gritty, what's the time commitment, how are we doing this during COVID, what are we looking for when we make selections, any and all of the above. So it should be a fun time. So I'll start just by answering some of those background questions, give you a little bit of context. So why was the organization created? So we as a chapter, we were created in Alabama as a chapter of a national nonprofit back in 2015. I think that, the needs in Alabama are really great. The map that you see here shows primary care, health professional shortage areas. But our state also has shortages in mental health and in dental and in other areas. And it's, for me, like what this map represents is really just the fact that either based on geography or based on socioeconomic status, a lot of people are disconnected from care. And we know that, access to care is one of many things that impact a person's health. And so the Schweitzer Fellowship, I guess, situated itself in Alabama as in other places to try to bring more attention to that for health professionals. So 67 out of all 67 counties in Alabama do have a health professional shortage area for either, like I said, primary care, dental, mental health. So I guess just in summary, I would say we were founded to help future professionals identify and address health disparity. But I guess our roots are really connected to Dr. Albert Schweitzer, who you also see here, who started a hospital in West Africa called Lemberene. And that kind of became the inspiration for our national Albert Schweitzer Fellowship organization, which dates back all the way to 1940. So it was originally created just to send a handful of medical students to serve at Lemberene. And then in the early 90s, it grew to actually have domestic fellows. So next question, and I'm going to ask, I apologize, I forgot to introduce. I'm joined today by one current and one former fellow, Tanya Nix and Catherine Jones. And so they're going to tag team with me and answer your questions. So Tanya, can you tell us a little bit about the time commitment and how you've been able to balance? Oh, wait a minute, we can't hear you.
Sorry, I muted in case my dog started barking. Sorry. I'm currently a DNP student at the School of Nursing at UAB. And my fellowship is with Albert Schweitzer, is with transitioning the paper charting to electronic medical records at the School of Nursing's Foundry Clinic, which is a free clinic offered to underserved communities in the Birmingham and surrounding areas. So balancing school and work is just what y'all are experiencing now. I work full-time, go to school part-time, and then have the fellowship part-time, and in addition to family. And it is, in the beginning, just with anything, just the adjustment, knowing how you have to put time away for certain projects. It's the same with this. With COVID, it's definitely had an impact on all of our projects in the fellowship, but Kristen has been very good working with us, and our mentors at the site has been great with working with us on making provisions, just like, we have in all areas of our school and work and at home. But it's definitely doable. It's very rewarding. You challenge yourself and you have qualities that you didn't realize that you had, I guess, and just trying to improvise and make it work. It's been very rewarding.
And I'll just add to that and say that many of you may already know that one of the kind of requirements of being a Schweitzer Fellow is that over the course of the year that you dedicate 200 hours to, plan and implement and evaluate your project. And so I just help people think about that. If you break it down by the week, that's about 4 to 5 hours a week. Projects can be done, kind of with fluctuating schedules, meaning that if you're going to have a bigger break at some point in the year based on your academic calendar, sometimes people do, plan it so that they will do a lot more in that time frame, and then maybe they only need to do 2 hours a week at other time frames. So know that there's flexibility. But like Tanya said, I think rather than feel overwhelmed by thinking 200 hours, think about it in terms of, well, how would I build in like 4 hours a week?
And also be aware when you're planning or you have an idea in your head, your population's availability. So if you're interested in children, that might be during school hours or evening time. So just kind of think of when would be in advance. Always planning in advance is going to help you more achieve your productivity, right? So be thinking of when your population is going to be available, even in the formative stages, because that'll help you plan as well.
So Catherine, maybe you can continue to talk a little bit more about the parameters for the scope of the project.
Oh yeah, of course. So I'm Catherine. I'm a fellow for life. When I did the fellowship, it was in 2017 to 18 when I was getting my master's in public health. I'm now a third-year PhD student in the rehabilitation science program at UAB. And so the scope of the project, it really depends, but what you're going to be doing, and you'll learn more about this as you get further along, is you're looking for a results-oriented framework. So we have these big ideas, right? But we want to get more specific. We want to be smart about it. And when I say smart, we want to get specific, measurable, attainable, relevant, and time-based. So you always want to keep those things in mind when you're thinking of this project. And also we want to be thinking about our population. Who are we interested in? What's the problem that we see that you're most interested in? So people not getting vaccinations for HPV. Okay, so what's the age group? How do we make this more specific? Because the more specific you are, the more likely you are to develop expertise in this field, as well as not have this grand idea that when you get into the heart of it, you're not achieving it. So you want to also, and Kristen and the whole program is really great in helping you design a results-oriented framework. So the scope can be rather large or small, but you want to get specific. But the main thing is think of the problem that you want to address. What is the unmet health need? And if you haven't already, be looking up social determinants of health, because that's going to be a big thing when you design your project. And then examples, I'm kind of, Kristen, when they say provide examples of the scope, are we talking like different projects that people have done, or?
Yeah, why don't you tell them a little bit more about your project specifically?
Oh yeah, I did one. I forgot. Anyway, so in 2017, I wanted to help elderly individuals, particularly those in nursing homes, because there's a lot of unmet health needs in nursing homes, and that people aren't getting enough socialization. They're lonely. There's more depression, things like that. And I'm an artist, and I'm also interested in rehabilitation and depression. So I decided to do art therapy, arts and crafts with individuals in a nursing home. And I dedicated a good bit of time to my project, probably more than some other people, because I was very involved in this. And this project actually helped me launch myself into the rehabilitation science program, because it taught me that rehabilitation was what I truly wanted to go into in my research career. But anyway, art therapy, went in twice a week, spent 1 hour, 2 hours a week with the participants, about 2 hours a week planning. And we just did different art therapy exercises. And this wouldn't have been achievable without great communication with my site mentor. So she was very helpful in helping me select the population who would most benefit from this, because a nursing home is full of people with different healthcare needs. She was very helpful in helping me communicate with the participants, ensuring that they're there. And also, this isn't, I'm very research heavy, but this doesn't have to be a research project, but you do want to go in with something measurable at the end, so you can show something for your efforts, right? So I went in, I wanted to measure depression and socialization. I had access to different social work files from my mentor at the site. And we saw after 3 to 6 months in the program, there was 15 people had an improvement in their depression, a lot more socialization, a lot of people leaving their rooms and becoming more involved in activities in the nursing home outside of art class. So we improved their quality of life. So be thinking of these outcomes as you're going through, like, is it quality of life? Is it depression? Is it, vaccination rates, flu shot rates, these things? What can you influence with your project? And with mine, I was able to go and help people improve their quality of life in nursing homes. And these were people who were at the end of their life. But I also learned that people are extremely resilient, and they are not defined by these healthcare needs that we think that they need us to address. They're not defined by that. So yeah, I'm rambling, but anyway, it was great.
Yeah. Thank you, Catherine.
Yeah.
Your passion is still very clear, which is
yeah.
exciting. And I'm just going to show some pictures so that people can get a sense of maybe other projects that have been done and realize kind of the breadth of this. So we talk about how the fellowship should serve people who are vulnerable. And if you think and look at kind of what health disparities, who it mostly impacts, it is people with disabilities, people who are low income, ethnic minorities. There's sort of a certain populations. And so you'll kind of hear that as a common thread in a lot of these. The top left project was a student who worked with individuals at Glenwood, specifically those who have, mental and behavioral health conditions. She knew that they were not very physically active. And so her goal was to try to get them to be, less sedentary in their daily life. We've had environmental health projects that were about mobilizing youth to do environmental stewardship projects. There are always projects dealing with nutrition. And so, we've had projects working with kids in after school and camp environments to eat healthier and make certain lifestyle changes. The bottom right picture was of a school-based, more of a kind of social emotional learning program, but specifically it was taking place up in Walker County, where opioid rates are like national levels of high. And so they were trying to work with middle schoolers to try to build some drug resistance skills. We've done things like gardening. And again, the bottom left picture is another kind of creative way to involve kids and their families in learning healthy cooking skills. So, and then Tanya obviously mentioned that she's doing something that's more about building capacity for an organization. And so I don't want to shortchange those projects either. We've had individual fellows work at places like Pathways to try to help them prepare to create a childcare center, within their walls. And so a lot of times our projects are not just about serving individuals, but it may be that you're working more directly with the staff and agency in order to kind of build their capacity to do their work better. So either approach can be done. And I would just say that if you are excited by those and want to know more, I encourage you to look on our website. All of the fellows from 2016 to today are listed there. All right, Tanya, another question we had was about COVID, and you touched on this a little bit, but can you tell us any more about sort of how you or others seem to be adapting your projects?
So originally my project involved the school system and human trafficking and educating teachers and students and parents on human trafficking, since most of the targeted teenagers are through social media. So it was introduced in a portal app, and So when COVID hit, it kind of put a stop to that project because we couldn't go into the schools, and the schools were trying to just make some changes to adapt to COVID. And so my project now, as I had told you and Kristen had told you, is has been involved with building a EHR, electronic health record, for this clinic that's run by the School of Nursing, and then scanning the paper charts into that, just to help prevent duplicate testing and diagnostics to be done, and just to have easier access to the patient's chart. So right now it's working out fine for me because everything is done on the computer. And then the clinic is doing a lot of telemedicine right now that hopefully is going to be transitioned more to in-person in the next couple of weeks. So I'll be more involved with going into the clinic and, making revisions in the EHR as needed. So it's definitely had an impact on a lot of our projects, but everyone's been really good with helping us, go to plan B to make it all work.
And we anticipate, this isn't going to go away in February, when we select our next group of fellows. So we have at least the foresight now to tell applicants, okay, plan as if COVID is still, relevant. And, what that means for us is you need to plan something that can be done in a socially distanced format. We know that we're sort of intermediaries between you and your host site. So we want to, between your schools and your host sites. So we want to make sure that whatever precautions you're building into place, that your school and your site are both on board and feel like it's sufficient to keep you safe as well as to keep participants safe. So we do have projects this year that are taking place like after school to do, like running through Girls on the Run with groups, but they were able to do it outdoors. They were able to keep girls socially distanced. A lot of projects, though, are just going to a virtual, using computer, using phone, doing things that way. And that's also great. And I would say that we also are seeing just more capacity building projects for organizations this year, and maybe that'll continue next year as well. I put kind of a rough quote there that I heard from someone recently at United Way, who just emphasized that, organizations, this is a shock for their system too. And so they're really needing people who can come in and bring creative ideas to help them figure out how to keep delivering the services they were delivering. So you could serve as a great, tool for them to have those kind of fresh ideas. And I will just, kind of wrap up this question by saying that we've also been doing our meetings virtually. And, I'm the first to say I miss our in-person meetings. I'm hoping we can get back to that in the next fellowship year. We're just sort of taking it month by month at this point. But we will be looking for ways that, again, we just need to make sure that we're upholding best practices and public health guidance right now too. So that's good for students who may, if anyone, I think everyone on this call live is at least local, but for those who may, be living somewhere else, that you would know distance and travel to meetings would not be a challenge. All right, Catherine, let me turn it back over to you. As a fellow, are there opportunities to meet with other fellows or seek assistance with your project?
Yes, there's a lot of opportunities. Of course, I did not have to go through COVID, so I'm not quite sure how many more opportunities there are now, because I was fortunate enough to go to in-person meetings. But during my experience, I bounced all sorts of ideas off my other fellows, and they were so helpful because all of us are coming from different schools, different graduate programs, different areas of expertise. So always, if find a couple of buddies. You'll love all your fellow people, but they use your fellows as a resource, ask them questions, get their opinions. A medical student or someone in public health may know a little more about a research detail, or if you're interested in counseling, you might have a fellow who's a counselor in counseling programs. So yes, I think there's a great opportunity to meet with other fellows. And then to kind of answer, what are fellows for life? So that is like a network that was kind of compiled by all these different Albert Schweitzer chapters across the nation. And it's just a network for you to go back to and draw across and throw out ideas and meet with other people across the country, as well as stay involved in the Albert Schweitzer Fellowship. And your chapter in Birmingham, we have conferences. So it's just another great networking opportunity. And a lot of people who are fellows go on into their professional careers, and their fellowship has kind of changed their path. It changed my trajectory for sure. So it's a great way to talk to other doctors, other PhDs, other pharmacists and nurse practitioners. So it's a great professional development network for you to connect with other folks. And then yes, other fellows will always be helpful. And Kristen is also really great in facilitating conversations too. So always reach out to those resources. And there's a lot in the fellowship. So.
And I will add to that too, if that's okay, that, a lot of our meetings have been through Zoom. We did start off having meetings in person. And what I have liked about the fellowship is that everyone is so diverse, and you have, Kristen is real good about sending stuff out, like what school you're with, what your project is. And there's been several people from different schools that have helped me even with my job at work, not even associated with the fellow, like with, setting up telemedicine and stuff like that. So I do like that it's very diverse, and everybody is willing to help you and offer advice, or even ask you for advice with, whatever your project is or whatever school that you're with. So it's been really good in that aspect.
And I like that, Kristen, in the meetings, and maybe Tanya, this is more of your experience in the Zoom meetings, but it feels like it's a safe space, to really bounce ideas and address boulders and things that are happening. So it is a fellowship for sure. I think there's a true definition of fellowship there, in that you're all working together to help each other. So.
Yeah, agree.
This is more of just kind of a nitty-gritty question, so I'll answer it. Someone asked, how much is the stipend and how is it distributed? So for the 2021 year, it'll be $2,500, and we distribute it in 3 payments. Essentially, it's based on you meeting certain milestones. So, at the beginning of the year, between basically March, April, May, you'll be in more of that planning phase. And by the beginning of June, you should have what we call a project plan. There are some other little like pre-survey, that kind of stuff that we'll also ask you to do. And then you'll get your first payment. And then likewise, we want to make sure that you stay on track and are about, halfway through your project hours, and you'll get your second stipend payment. And then at the end, if you complete your hours and a final report and some other details, then you would get the remaining. So I think it's important. I'm glad someone asked that question, because I do try to say, for anyone who is working and putting yourself through school, this unfortunately is not sort of an hourly, you're not getting paid hourly. And so it's harder to count on those funds for daily living expenses because of kind of how spread out they are. But, the intention of the stipend is to try and make it so that anyone who is working is not precluded from participating in the fellowship because of, the need to earn some money. The other thing I'll point out, just while we're talking about hours, is we have had partner projects. So you can apply with someone else to sort of work collaboratively towards the same project goal. Last year, we took that off the application just because we were kind of making the application more lenient and not asking you to outline a specific project and plan and a partnership. And long story short, we do want to encourage people to consider doing their projects as partners. So we're trying to find a middle ground this year. So you can apply You could even apply as an individual and then maybe get in the fellowship and realize someone else has a similar interest and y'all decide to work together. But long way of saying that for partner projects, you kind of have two ways you can go. You can either say, well, one of the reasons I'm doing this is because I want to share the workload, and you're kind of splitting the hours. So we ask that everyone still do 100 hours of service, but you get to share the planning time. Or you can say, no, like we're in it together and working towards the same project and goal, but we really think that we need the total, like we're going to put in 400 hours collectively towards this project. And the only difference is if you don't do the full 200 hours, we prorate the stipend. But some people are really intrigued by the idea of a partner project because maybe 200 hours feels overwhelming to them. So if that's you, I would say, consider doing that with a partner, but just know that the stipend would be a little bit less if you don't reach the 200.
I have a question.
Mm-hmm.
So if you do, I'm sorry, my name is Janai Bostic. I don't know if it's pulling up. I'm on my phone because I'm rushing from clinic. But say if we do the partner project, I read the last bullet, but I just want to make sure for clarification.
Yep.
Do you still have to split the stipend with your partner?
So it depends. So it used to be that, yes, we just said, okay, if you're a partner project, you get $1,250 total each. But what I realized is that a lot of times partner projects were still putting in close to or even at the 200 hours. And so I got approval from my board to be able to prorate stipends and essentially, give you more for doing more. So it would be up to the 2,500. It's just that if you put in like 120 hours and your partner put in 115 hours, y'all wouldn't each get the 20. It would be closer to the 1,250 rather than the 2,500. So it just depends on, I guess, if you're trying to split the hours or if you're trying to still each get the full 200.
But say if we both did each 200 hours, we will still get the whole stipend. Like if we did everything together.
Correct. Each of you would get 2,500. Mm-hmm.
Okay, perfect. Thank you.
Yeah, thanks for asking. So I'll start answering this question about the selection process, and then I'll have Tanya kind of chime in and say how the process was like for her as an applicant. So essentially there's the application, which again, we've made, I hate to use the word easier, but sort of briefer. We've removed some of the planning that you have to do before doing it. Essentially, we just want you to show us that you can be, thoughtful, that you understand something about community needs, that you can kind of brainstorm and think creatively about maybe how to address it. We'll offer interviews, which will take place between February 16th and 19th, and there will be kind of a time and way that you can indicate your availability and pick a time slot for those days. The interviews are usually a panel of 2 to 4 members of our advisory council that will interview you, and it's just a further opportunity to get to know more about you, your interest, what you think you could get out of being in the fellowship, kind of your long-term goals, that sort of thing. And then ultimately selections will be made by the end of February, and we'll get started in March and April. We'll be doing some kind of virtual things in March and April, and it won't be until May 1st when we get together for orientation. And, I'm still holding out hope, and I'm talking to some people, the health department, for instance, to try to figure out how we can do that in person in a safe way, because I do think it just really helps build community among fellows for us to get some face time, even if we have to go back to virtual, off and on after that. In terms of what we're looking for, I've listed out some qualities there that I think are really important. You'll notice it is not that we're looking for people who have a stellar academic record, who have published, scientific articles, or who have been an AmeriCorps Vista or Peace Corps member. I mean, we certainly have people who've done those things, but we're really looking for people who, again, are just collaborative, who are humble, who are curious. So, hopefully that makes it feel like an approachable process. Tanya, anything you can add?
So the selection process, mine was, of course, in person, and it was where we held our meetings. And it was, it was nice because you do get to meet people while you're waiting for your interview and just kind of hear, why they are interviewing for the position. The whole interview process, as Kristen said, that we met with 4 different people and from a variety of settings. And I believe all of those were fellows that I interviewed with, previous fellows. Everyone is, it's very laid back, and everyone I interviewed, they were truly interested in what my passion was and what my project that I had in my mind was. It was just very helpful to hear, their experience as a fellow during the interview process. That gives you a better idea also of what to expect. But as Kristen said, it's very just know that you need to be very flexible and creative, and the population that you're wanting to service with the whole fellowship.
So you may have seen these, February 1 is our deadline. You apply online. I think everyone joining us today will still be enrolled in school through the fellowship year, which is good. That's another requirement. And then I want to make sure, again, bring everyone's attention to the orientation date, because that's something we don't have flexibility about. We do what I do for the later meetings. I don't think this was a question, but I'll go ahead and mention. So I try to set some tentative dates so that as soon as students are admitted, I can give you that list and find out if there's any conflicts. I try to make sure and pick dates that don't overlap with holiday breaks or anything like that. But if I see that I've picked a date that there's going to be a lot of conflict around, then we can adjust it. Our meetings they've usually taken place on a weeknight from 5:30 to 8 p.m. Our retreats are usually weekends. I have started to consider whether weekends would, like maybe a Sunday afternoon would be better for everyone. So again, we'll work through those kinds of details once we have the fellows selected, so that we ensure it works well for everyone. But either case, I think the takeaway is meetings don't take place on weekdays because we know you're in class. So there shouldn't be that conflict. I think I'll just open it back up to Tanya and Catherine if there was any final advice they wanted to give you before we take any other questions.
My advice would be, find what you're truly passionate about, and kind of go with that. It makes it more, I guess, rewarding and more, feel like you're making a change in something that you're truly passionate about. And try to, Kristen is real good about providing a list to help you find your site mentor, or even organizations that are willing and or like working with the fellows, and find that person that is your site mentor that you feel confident will, I guess, help guide you and work with you, because that's really important too. And as I said, as Catherine and I both have praised Kristen, she's always been available, and she's always very good about reaching out if you have concerns or issues with your project, and helping you kind of make revisions when needed. But it's a great project. It's a great fellowship, and I've enjoyed meeting everyone and hearing about everyone else's fellowship project. So it's been very rewarding.
Yeah, I agree. It's a very rewarding experience, and it really changed my trajectory. It made me learn about, cultural humility and social determinants of health, and just learning about how to develop a service project and going out into the real world and seeing what changes we can make in the community that's outside of these cold conditions in research, and this isn't a research project. But I do want to advise, as you think through an idea, again, let's go back to those SMART principles: specific, measurable, attainable, relevant, and time-based. Also, be thinking of your population you're interested in. What is the problem you want to address? Is there a comparison or thing that's been done before? And what outcome are you interested in impacting? So PICO, population, intervention, what's the problem, comparison, and outcome. And I know that's kind of research heavy, but it doesn't have to be a research project, but having some of these research principles in the back of your mind may help you make this idea more achievable. So, yep. Go with what you're interested in. Where is the problem and how can you help?
So I think I have contact information for some of you, but not everyone. So before we take questions and I might have people dropping off, I just want to point out that I want to make sure I have your name and email address. So if you don't mind, and I'll drop this in the chat too, but please, share that information with me so that I can stay in touch. For instance, I'll send you a reminder in a couple of days about like some office hours I'm doing virtually where you can pop in and ask me any questions. I can help you if you're struggling with a certain part of the application. I can help you work through that. So with that, I will open up any other questions that people have.
I have 2 questions. So the first question I have, if you're doing a partner-based project, do y'all both do the application together in an interview together?
Yes.
Okay. Oh, I guess that's really only one question, but thank you. I really appreciate it.
Yeah, no, that's a good question. So there is, when you look on our website, there is a separate partner application, and you'll notice it basically just has extra fields where, the second person can give their contact demographic kind of information, but then you're just having to answer the other questions one time a piece.
Okay, thank you.
Yeah.
Hi, I wrote this in the chat, but I was wondering when the application will go live.
Oh, hey, Paxton. Yes, so it should be live now. In fact, I've received, I think, 1 submission, so it seems to be up and running, but if anyone has any problems in the process, let me know. I will point out it doesn't have the functionality of being able to save your changes and go back to it. So there should be a template on the website, like a Word document you can download. So I usually encourage people, fill it out, get all the answers on paper. And then that way, when you're ready to submit, you can just go back in and copy and paste into those different fields. The only other thing it asks for that you might not be thinking about ahead is you can upload a resume. We ask that you keep it to 2 pages. We know y'all done a lot of amazing things, but just for the sake of our reviewers, limit that. And then the other thing it'll ask you for is 2 references. These are not letters of recommendation, so you don't have to get anything from people ahead, but they are individuals that maybe can just attest to your, character and past experiences. And we will follow up with them prior to selecting fellows. It's just kind of another way that we gather some information and make decisions.
Kristen,
So it'll ask for names and like contact information.
Thank you.
One clarification. Is their CV okay, or does it have to be a resume?
A CV is fine. I guess I use that term interchangeably. It's just usually CVs I think of as being like 17 pages long.
They can be.
And the system honestly won't recognize if you upload something that's longer, and I'm not gonna come back to you and be like, no, you have to shorten this. But anyway, it's just easier for everyone all around if you try to condense your things.
Thank you.
Hey, so I'm a second year physical therapy student. And so part of this application or the implementation, I'll be in clinical. And October through December, I'll be in Texas. So is that something, could I still attend the monthly meetings or still do a project with that being in my clinicals?
Yeah, no, that's a good question. I'm glad you're thinking ahead about that. So I think, that's one of the benefits right now of COVID is that we've all had to figure out ways to connect for these meetings and for our projects in a virtual way. So my recommendation would be plan your project so that you could continue to deliver it during that time. So knowing what your schedule will be, that might mean planning something that you could do at night or on the weekends when you aren't in your clinical site, for instance. And then again, just knowing that our meetings will take place. So there would be, so the one thing you and I should probably talk about is we do a mid-year retreat, and that's usually in person. Again, this year we had to move it virtual. So we could talk through kind of what that would look like, because it usually does fall either late September or early October. But otherwise, I would say yes, like meetings can be attended virtually, and then projects will just need to either assume that you're doing something that can be done from a distance. And this is something for everyone to consider. Like, we have medical students who, if they're participating a second year, they may have step studying that really kicks in like March. So I tell them, well, then let's plan your project so that you're wrapping up most of your activities by end of February, for instance, or early March before step time starts. So it would be the same for you. Like, think about what those breaks are. And if you say, I'm really not going to have time to dedicate to my project, okay, well, we need to plan something then that you can do more before and more after, and still get that time in.
Hi. I just wanted to ask if we need to talk to the organization that we're thinking about partnering with before we submit our application, or is that something that we should just kind of wait and see until we're able to get planning advice from y'all?
Yeah, well, first of all, I'm super excited that you have a partner idea in mind. That's great. This is one of those things that we've changed, just trying to see what works best for students as applicants, and then also for our partners. In every other Schweitzer Fellowship site, it still goes with the traditional way of doing it, which is you apply with your site pre-identified. And so in the past, like when Catherine applied, she had to already know, this is who I'm working with, this is who my site mentor will be. We just found that there were a lot of, so there's pros and cons. One of the pros is that if you go ahead and have that conversation with them now, then, there's going to be a greater likelihood that it'll work out in the end. Or if it's not going to work out, you'll know it now and you'll have more time to adjust. The con was that we had, students building relationships and feeling like they were making some promises to organizations, and then sometimes they weren't able to keep those promises if they weren't selected, for instance. So I think you could go either way. I think if you have a relationship with an organization that you've maybe volunteered with or something like that, it can't hurt to go ahead and start that conversation. But just know that we aren't expecting that out of applicants this year, that we sort of give you some leeway to work through that in March and April. But we will, by like April, be pushing everyone to have a site by that point.
Awesome. Thank you.
Mm-hmm. I'm going to go ahead and show y'all this, but keep asking questions if you have any others. We've had some earlier sessions. I think there are 4 now that are online that talk about everything from like, how to sort of tap into any research interests that you have, to how to build from your experiences and think about, a lot of times people are like, I have so many interests, I don't know where to start, so anyway, these 2 topics as well as 2 others can be found on our YouTube page. So if you feel like you missed anything, we really jumped in today and just tackled those questions that we had been given. But if you want sort of a more of a broader overview, feel free to go back and watch those. And they all have fellows and fellows for life that share their experiences as well. And then the other thing I wanted to point out is we are trying to share a lot on Instagram and Facebook and Twitter as well. And we'll be doing more of that in like November through January. So if you're on any of those social media platforms, please follow us, and that'll be another good place to get some additional ideas. Any other questions before we wrap up?
To clarify, piggybacking off of the previous question, that we don't have to reach out to our organization of interest prior to our application, but y'all will give us time, right?
Correct.
To confirm it.
Yeah, that is a much better way of saying what I kind of talked around. So thank you.
Thank you.
Yes. And I think, you know, that's an example of something that when you get into an interview, you'll be able to, you know, tell the committee a little bit more about like, well, this is who I've thought about approaching, and this is, you know, what I might be able to do with them. So the interview is kind of just a good opportunity to share any other details. And also the interview doesn't take place until February. So even if you don't feel like, or late February, so sometimes these things start to fall into place over time. So even if you apply and you haven't talked to the site and then later you have an opportunity to do so, you can always share that kind of information with the interviewers. But we are not expecting it.
Thank you.
All right. Well, if that is all, I'm going to stop the recording for today, and I am happy to stay on here